it's Scott. And for this week's Give Me 5, I'm here in Gatlinburg, Tennessee at a Tennessee EMS conference. And specifically, I'm here with Angie, who's one of the nurses and the medics from the Region 2 EMS Medical Directors Association. And when we were talking this morning, I came up with this Give Me 5 because it was truly a unique topic that honestly I haven't thought of in a little while. And that's the whole idea of if you've got a kid that's exposed to something really icky. We know that dilution is the solution. However, that's great, that's what's taught in school, but when it comes to little babies and little kids, many times there's got to be a better way. So with that, Angie and I were talking this morning just about some ways you can actually decontaminate, otherwise known as flush the icky stuff away when it comes to babies and kids. Angie, any insights?
Just a few. So first of all, anytime we're decontaminating children, we need to make sure that we keep them warm. We know that kids are much more prone to hypothermia than adults because they have a greater body surface to weight ratio. So always keep them warm. If you have a way to warm the water that you're deconning with, that's great. Finding some clothing, some warm towels, some warm blankets to wrap them in afterwards is very important.
So that's going to come into play because normally if you look at a decon shower outside of the ER or outside of a fire truck or something of that sort, they've got boatloads of water, which is phenomenal, but it's whatever the ambient temperature is. So if it's really cold outside and the truck's been sitting outside, that means the water coming out is really, really cold as well.
So the other thing I think is to think about how you're going to safely do this decontamination. As we know, kids, it's kind of like herding cats when you have to decontaminate them. And they get slippery, especially when we're talking about the little bitty ones. So Scott and I were just discussing a few ways to mitigate the possibility of them getting injured while you're trying to do them some good. So I think that in our older kids, shopping carts are always a great idea. I think a lot of people use those. They store their decontamination supplies in the shopping cart, and then when they need them to move the children through the decon line, they can put them in there. Kids are used to shopping carts. They're comfortable riding around in them. They've been to the grocery store with the parents in a safe environment. So that's one great thing.
And they've got the holes in the bottom, which is something we'll touch on in a second. Shopping carts are great if, number one, you happen to know where your shopping carts are. And number two is the shopping carts are kind of nice though, because like she said, kids are used to being in shopping carts. But the nice part is that they got the holes in the bottom. So that way, whatever gets poured out on top that hopefully drips out doesn't just allow them to continue to marinate in it.
So the other thing that we were discussing is the use of laundry baskets. People have used those, but one of the issues with laundry baskets is sometimes they don't have holes in the bottom, so that water does accumulate. And with that water accumulates the bad stuff that you want off of them. So if you're going to use laundry baskets, maybe pre-drilling some holes in those so that the water drains to the bottom. But another really good idea that Scott and I were discussing this morning is the use of car seats. If you'll take a car seat and take all the soft squishy stuff out of it, what you're left with is hard plastic that usually has ventilation holes in it, and those ventilation holes also serve as water drainage holes if you use it when you're deconning them.
That's honestly what kind of caught my ear this morning, was just we were touching about this whole idea because Angie's got some really unique experiences with hazmat and nuclear and radiation and just essentially all things icky. But when I heard the car seat idea, I'm like, okay, that is seriously cool. I've never come across it in my years of playing nurse and medic. So again, just taking a car seat, ripping all these stuff out so that it's got holes in there anyway. And you can, in theory, you can strap the kid in so that way they don't fall out of the car seat. They're used to being in a car seat. You rinse the heck out of them, and then once they've been through the shower, then you can go ahead, dry them off, warm them up, and do what you need to do. With that, adults are simple. You can go ahead and just have them walk to the shower very appropriately so. Issue number two is you have to get people naked. And remember, naked means naked, right? No diaper, no underwear. Modesty goes out the window. You have to go ahead and wipe and rinse. So as long as you rinse the heck out of them, then you can remove over 90 to 95% of the bad stuff before they ever wheel through your doors. And whether that's with shopping carts or the little laundry bins or the seriously cool trick and little ones of using a car seat, dilution is the solution. And with that, that's this week's Peds Give Me 5.